I talk about outcomes and experience of patients with CAR T-cell therapy, but from the perspective of a advanced practice nurse working with patients with cellular therapies. I talk about some findings from real-world data. So we see that there are chronically ill patients, a lot of third-line or fourth-line therapy. Real-world data show that up to 400 months from the diagnosis, over 500 days after apheresis, CAR T-cell therapy starts or retransfusion will be given. And if you look to the illness trajectory of lymphoma or myeloma patients, so you see that this CAR T-cell therapy is only a small period of the whole trajectory of a chronically ill patient. We also see that there is a high proportion of elderly and even frail patients in the CAR T-cell patients. Real-world data show that in Europe patients are up to 83 years, in the US data up to over 90 years, and that 9 to 19% of patients have an ECOG performance status of 2 or higher. There are also, because of the third line, fourth line therapy, also a lot of patients in palliative conditions. And those patients receive side effects after the retransfusion of the CAR T-cell therapy, like CRS, the cytokine release syndrome, or the neurotoxicity, the ecancer syndrome. CRS, it depends on the product, up to 13-14% grade 3 or higher, and the ICANS up to 24% grade 3 and higher. And maybe you ask yourself if it's worth to get all those side effects with this therapy. And I have a really interesting case I will present. Not a typical CAR T-cell patient. It was a very challenging patient, but we learned a lot from this patient and from this case study. So it was a patient, he came to the lymphodepleting chemotherapy where the CAR T-cell retransfusion starts with, and he came to the chemotherapy set and came there and said, no, I don't want this anymore, I want to die. We have this option in Switzerland, with assisted suicide, so this is an option patients can take. So we started a discussion with the patient, 2 more discussions with the physicians, together with the wife, and at the end of this discussion, the patient said, okay, I will do this. And well, he got the worst ICANS neurotoxicity side effects you can get, and it was a really hard way for the patient, but even for the staff, nurses and doctors, for the staff on the ward. It was really challenging for us, and we thought, how can we handle this? And we found 3 questions. We think a patient could ask, in this situation, in this palliative situation, a patient can ask himself. So in German, it's 3 words, and you can pronounce a different word. In English, there are some more words. Do I want this? And you can ask yourself, do I want this? So, is it my wish to receive a CAR T-cell therapy, or will I do this for someone else, which probably is okay, I think. Do I want this? Is this really what I want, or do I want something different? And do I want this? Is it really a CAR T-cell therapy I want, or maybe are there other options? maybe better fit to my conditions. And this helped us to think about asking these questions to the next patient, helped us to cope with this situation. And then there was an interesting change, 3 months later, after he resolved and was discharged from the ward. We all thought he will go to assisted suicide. And I met him 3 months later in our outpatient clinic, and he said, "Oh, I'm feeling so well, and this was the right decision." Is what some studies also say, who examined the patient experience of CAR T-cell therapy, that even before the therapy and after the therapy, the advantages from the patient perspective of the therapy are more than the disadvantages. So this was really an interesting case. So I resume in my presentation that we have chronically ill patients, elderly patients, sometimes frail patients in palliative conditions, that at the end mostly the advantages are more than the disadvantages from the patient view. But to look at my role, that it's important for such patients that they have a contact to advanced practice nurse. To other healthcare professionals, I always have the message, let us work together. Clinical practice, I always think it could be more, that we work together and not against, or every profession for its own. And even if in such a challenging patient group like the cellular therapies or the CAR T-cell therapies, they need us work together so that we can give the best outcome of our work to the patient.